breast cancer incidence, unfortunately, is going up, and it has overseeded the cancer incidence of cancer cervix. Now, in that scenario, now this is a breast cancer awareness month. Our chairman is very keen to start a dedicated cancer department which takes care of the breast cancer illness. So across the country, in all the Apollo Cancer Hospitals, we have started centers with dedicated breast cancer centers with immediate diagnosis, immediate screening. On the same day, we are going to diagnose any kind of suspicious lesions in the breast, including the pathology, and the next day we can take the patient for treatment. If the patient requires any kind of surgery, immediately we will be taking up. Most of the young women in India, unfortunately, are developing breast cancer, and we need to have a faster diagnosis because early diagnosis makes a huge impact on the overall treatment and cure rates. Not only that, even if you diagnose the patient at an early stage, we can even get away by doing simple lumpectomy without chemotherapy and radiation treatment. So this is how the cancer incidence, as it is growing, we need to focus on a dedicated department, especially for the breast cancer, because the breast cancer happens at a prime age in our country, between the age of 35 and 45, which is the prime age of any woman, and we need to take care of these women, and because women are very, very important for a family. Breast cancer is very, very easy to diagnose. It's an external body, and we always suggest women to feel their breasts while taking bath. Any painless lump, please do not neglect. Please come to the hospitals. We'll do a simple screening test. We'll do an ultrasound. We'll do a mammogram. And we'll put a needle if you suspect that it could be malignant. We just put a simple needle, and within a couple of hours, we'll be able to diagnose whether it is malignant or not. Thank you.
So today we are going to launch most precise and fastest care for the breast cancer patients. So it is going to be the fastest and the precise breast cancer diagnostic program, which is only available in Apollo. So once a woman comes for her breast evaluation, within a day, she will be knowing whether she is having underlying cancer or not. So once she comes to the hospital, after making her registration, within 15 minutes, she will be taken for the mammography or ultrasound depending on her age. If she is more than 40 years, she will be taken for the mammography, and if she is less than 40 years, she will be taken for the ultrasound of the breast. On mammography, we look for any underlying cancer is there or not. And the mammography, what we have is the 3D mammography, which is one of its kind. It's the one of the best quality where chances of missing cancer is almost none, because here breast is evaluated through thin slices. So that we don't miss any cancers. So once the mammography has been done, within 15 minutes, her reports will be ready. Once on evaluation, if she is found to have no problem, there is normal breast or no cancer, she will be reassured and sent back home. But out of 100, 2 or 3 women, they may be having some lump, which may be having some suspicion for the cancer. So those women will be counseled for the FNAC or biopsy. Now those FNACs and biopsies also will be performed by the radiologist under image guidance, depending on the area of suspicion. Now the FNAC, once it is done, within 4 to 8 hours the report will be ready. On the same day she will know whether she is dealing with any underlying cancer or not. Sometimes we may need to do biopsy. On biopsy, we will know again what type of cancer it is. So that will take around 48 hours. So the diagnostic procedure is done within 24 hours. She can go back home free of any tension that there is the entire workup has been done. Now once the pathology reports come, she will be further guided to the specialists who are dealing with the breast cancers and the breast problems, and then further treatment will be given to her depending on her biopsy report. Yeah, so this is very good question, that what age they should be start evaluation. So ideally for evaluating breast, they should have 40 years for evaluation with the mammography. Now women who are less than 40 years of age, if they have lump, they can come for the ultrasound of the breast. We avoid mammography in younger women because mammography has got very minimal exposure to the radiation, which we don't encourage for the younger women. But if on ultrasound of the breast, even in younger women, if there is any area of doubt, then they can go ahead with the mammography. But for mammography, any women who is more than 40 years of age, they should go for annual screening mammography. If they already find a lump, first they should visit the clinician, and then after a referral from the clinician, she should undergo either mammography or any other imaging test. Thank you.